Then which one of you wants to start off?
I can start, and then Laura can jump in. So my name is Debbie Jones. I'm with Bay Cove Human Services. I've been with Bay Cove Human Services for a little over 20 years, so a long time. I started working with people with mental health challenges at the end of deinstitutionalization, when people were really coming out of the state hospitals, and worked in that part of the mental health world for a while, and then more recently have been involved in emergency services and shelter services. I happen to oversee the contract that Bay Cove has with Boston Medical Center and BEST, which started in 2003, and is the we started with the emergency services and then the 2 crisis units, and because of that experience, I think the collaboration with Commonwealth Care Alliance came about.
Okay, let me just tell you, since you may not know this, that Best has been on this broadcast.
Ah, good.
Jennifer.
Yep.
So she has been on the broadcast, because when I started, I wanted to be sure that people knew that if they were watching and they had a question, but they didn't want to call and have their voice on air, that they could call afterward and that I would tell them where they might be able to go to get services. So she came and talked about the introduction to BEST for people coming, just arriving at Boston Medical Center at the ER.
Great.
So so that was very good.
Very
And-
good. Perfect.
Hi, good night, good evening. I'm Lauren Easton. I'm the Senior Director of Behavioral Health at Commonwealth Care Alliance. I have been with Commonwealth Care Alliance for over about 13 years. Prior to Commonwealth Care Alliance coming into existence, we were a primary care practice group founded by Dr. Bob Master and his wife, Marie Felton. And it was a very small primary care practice that focused on folks with physical disability and developmental and intellectual disability, about 600 folks in this primary care practice. I started as a clinician with this group and did a lot of home-based individual therapy. I moved into their behavioral health consultant and manager, so that we very quickly integrated behavioral health with their primary care practice. Commonwealth Care Alliance is now a large health insurance company as well as a clinical delivery system. So it's a very unique organization where we are both the payer as well as the clinical services. So we have a senior care option program, and we serve folks that are over 65 in the community. We have about 5,000 members across the state of Massachusetts. And in October of 2014, we began the demonstration, the duals demonstration that serve folks with both Medicaid and Medicare under the age of 65. This is when we really started to align our partnership with Bay Cove Human Services.